link afterwards. Thank you. Thank you. Welcome, welcome everybody. It is so fun to be here today with all of you. And I know I've said it with every communication, but I can't thank you enough for participating in this community-wide study. We know how time intensive this survey was. In full transparency, 5 individuals on our team logged into Zoom, I don't know, 3 or 4 times for an hour and a half a piece to get it done on our end. So we know the massive effort it was, and thank you. And I hope that you find the information today valuable. Our commitment is it doesn't stop here. This is something that Glasser Schoenbaum is committed to helping our community get better in, because network efficiency matters. And that's kind of the whole takeaway with this data. So with that, I'm going to turn it back over to the Visible Network Labs team. This is the agenda today, and you can read our process here.
Wonderful. Thank you, Cameron. So we're going to hop right into discussing the survey results and giving you a little bit of a primer about how to think about them. I'd like to turn it over now to Dr. Danielle Varda. She is the CEO of Visible Network Labs. And she's just going to say a few words to put you in sort of the right frame of mind to think about these results.
Oh, great. Thanks, Amanda. What Amanda means is I get to be kind of nerdy about networks for a minute before we get started, which might be my favorite thing. So our team is so grateful that you've let us into the community to do this work together in partnership with Glasser Schoenbaum, and the team there. So thank you very much for that trust. We do our work with a network science lens. So what we like to do is kind of get everyone on the same page with what we mean by that. Network science is really just the science of how things are connected. It's a pretty tangible science because we're all connecting every day to lots of things and people at a pace we never have before in time. And so it's really something that folks are doing all day long, every day. In fact, one of my favorite things to say is that you already are a network scientist. So our hope is just to give a little bit of language to that science and data to help build capacity in a community and move the community forward in terms of, I think Cameron just said network efficiency matters. And we believe that also. So we're doing network science all of the time. We use a specific tool called social network analysis to measure networks. That allows us to do things like look at the quality and quantity and outcomes of relationships and identify strengths and opportunities for improvement in that network, but also to grow and track growth and measure progress, which is something that we've been able to do here because we did this work pre-COVID, and now we were able to come in with funding from the Robert Wood Johnson Foundation to look at the network post or during COVID still, I should say, to really see how a network already in place in a community is able to activate in times of crisis or times of need. And so it's been really kind of amazing to watch the story of that happen in Sarasota and your surrounding communities.
Sorry, Danielle, can we just back up one slide?
Yeah.
Amanda, I did want to see that, the one before this, yeah. 2 before this, excuse me, this one. Okay, I meant to go over this one. Danielle mentioned the one after this, Amanda. Danielle mentioned just now that we had done this in 2018, and many of you on the call today participated in 18. And I just wanted to show you a quick comparison of pre-COVID and then during COVID. This is the difference between the 2 studies. We had 41 organizations involved and invited the first time. 88 were invited this time. Survey response rate was 73% the first go around, 76% this time. And the total relationships sort of exploded from 612 to 1605 in this current data set. So you can see we grew in partners and in capacity here. Okay, just wanted to get that out for a little context.
And thank you, because I knew I wasn't supposed to present that slide, so I'm glad that you did. So just a little bit more level setting. We've all used the word networks here, and I wanted to explain kind of what we mean. When we say networks, we're literally referring to what we talk about as nodes and lines. So nodes can be organizations, people. We conceptualize them in all of those ways in this network, community network, and then the lines between them are the relationships and how they're connected. So Cameron just reported how many basically lines were reported in this data set, meaning the partnerships between all of the people and organizations. This is important. There's lots of ways we talk about partnerships, collaboration, coalitions, collective impact. We use the word network because we're measuring it. So measuring networks using this approach requires this kind of conceptualization of the nodes and the lines and how we measure those. And so that's our goal. That's what we're doing. And that's how we're going to, talk about this today. And so I'll just do on the next slide one kind of pass over on why we might care. Like, why do we want to collect this kind of information? For one, we know that these kinds of relationships are pretty invisible, but maybe, one of the most important factors to a lot of our outcomes, both at individual levels and at systems levels. What we do, so this slide is meant to kind of, you'll see the title says Life Cycle of a Sustainable Network. So we've been doing research on networks for almost 20 years and looking at what makes them effective and what makes them sustainable. And we know we're at a point where networks are just prevalent everywhere. It's a strategy funders are funding, legislators are talking about. So it's really important that we get a handle on these, one, to say how sustainable are they? And two, how can we stop over networking our communities so that we instead can leverage existing networks? So I'll just go through this real quick because hopefully it helps you start to think about why these mishmash of nodes and lines might make sense. If you look at the picture in the middle, it's the squares and circles where they're placed are in the same place in all four pictures around that circle. So the only thing that's changing in the four images around it are the lines between them. And so what often happens when we start building networks for any reason is we bring people together who we know are part of an initiative, and then we usually define who or identify who's not at the table. And very quickly, we'll move into this phase 2 where we start to invite folks and build up the network. That's a network approach. Phase 3 is often where networks get to and stay forever. The strategy is usually to grow the network. What happens though, our communities are kind of exhausted already. We don't have a ton of resources. We never get to add networking and collaboration as a line item on our budgets. And so we're just building a cost without a lot of ways of thinking about how are we going to maintain the same level of energy, the same collaborative advantage, but over time reducing the amount of resources we actually have to put into it. So in phase 4 is where we try to help communities really start to think about how do you formalize some of this? How do you maybe create 4 work groups? This is just an example. Give people roles of where they can play a good part in that network, and then start to invite people to play that role only when necessary. So we stop inviting everyone to everything, and we start thinking about how to strategize in a way to reduce the amount of resources needed to do that same work well. So it takes a little bit of work to get there, and it takes a strategy. We can leave it to our gut because we're humans and we like to connect and we know how to connect, but from an organizational perspective, it can become really inefficient when we're starting to ask people to do more networking than maybe provide even their direct services to people. So in your community, we see, some of this already happening, and we're hoping that we can help to support thinking and decisions around how to leverage the connections that are here and build on them and strengthen them, but also to use resources wisely in a way that can really hit a few more different outcomes at the same time. So on the next slide, I'm not sure who's controlling these right now. So just, we hope that you've seen some value in collecting this kind of evaluation data, and that just a key couple of points stand out, that building and managing these networks doesn't have to be left to chance, that there are a science and data to guide you, and that you're already doing network science every day. So this is just adding a little bit of capacity around science and data, hopefully, to that everyday work. And we really believe that more networking is not better networking, but more relationships aren't necessarily better because of these limited, what we call relationship budgets. So how do we build strategies that help us kind of manage that? And so, just to kind of round it out, we really do hope that the next step in this is action oriented, that there are ways that we can help build capacity and develop different strategies that can help reach those outcomes. So with that, I'll hand it over to Amanda, or I think Rose, who's going to go through our survey results.
Thank you, Danielle. Yes, Rose Hardy, our network scientist at Visible Network Labs, is now going to get to really the heart of this presentation, where we talk about the results that we found from the survey.
Yeah, I will say, as Cameron mentioned before, there were about 88 organizations that were invited to participate in this survey, and 67 responded, of you all responded, meaning we had about a 76% response rate. So members of the network tended to be involved in health and education and social services. In fact, about 76% were designated as social service providers. Of course, health systems and public health service organizations were important parts of this network. Other organizations like foundations were part of this network that helped Sarasota residents receive social services during the pandemic. So again, here's this very large and maybe confusing network map. As Danielle maybe mentioned before, these circles here or nodes represent organizations within the network, and the lines between them indicate the relationships between different organizations that have occurred during the pandemic. And here they're color-coded by the service that they were providing. So you have blue circles that are the health systems, orange circles are other types of organizations like foundations. Public health service organizations are in purple, and those social service organizations are in green. And then in addition, they're sized by the number of relationships that they have within the network. So the larger circles indicate that they're connected to more organizations within the network than your smaller circles. So smaller circles are less connected to other organizations. And a part of what we're seeing here is that there are several foundations, some of those larger circles, orange circles towards the middle of that network that have been connected to a lot of different organizations here in Sarasota during the pandemic. For a network where social need referrals from health systems to the community is sort of the main thing that you do, or one of the main things that you do, it might be a little bit concerning to see that some of these health systems and clinical care organizations are towards the edges of this network.
I just wanted to add that everybody in your main report got a key to all of these abbreviations.
Yes, yes. Amanda, if you want to go to the next slide. So, of course, one of the things we wanted to know was how you all have reacted really to the pandemic. From 2018, we know that members of the member organizations believe that they would be able to quickly expand services if needed based on their current circumstances. And we find that in the current survey that many organizations feel like they were in fact able to quickly respond to COVID-specific service changes. Giving us a sense that the network was able to activate pretty quickly given these circumstances. So what were the services that were provided during this pandemic? About 51% of organizations indicated that social support and guidance were one of the primary service provisions during the pandemic. Issues certainly related to health, including mental and behavioral health, access to care were also other main activities. And unsurprisingly, housing, food, and emergency needs were major needs and services that were provided at this time. So we also asked about what were new activities that organizations were providing during the pandemic. and services related to financial assistance and food insecurity were most likely to be new services provided by organizations at this time. Organizational priorities have unsurprisingly shifted some since 2018. In 2018, supporting families and communities were major priorities, as was the reduction in health disparities. During the pandemic, some of those have shifted some. Supporting families has remained important, but housing and finding better ways to share resources were also important. I don't know that anyone here, I don't know that I believe that reducing health disparities wasn't still important, but clearly there were other pressing concerns in the community during this time. So in service of those priorities, one needs to be connected to other people, right? And so one of the things that we looked at was how active these relationships were with other organizations during the pandemic. And greater levels of activity require more time and resources. And so it's important to understand how the network is using those resources and that time. From at the bottom, we have sort of relationships where we're only attending meetings together. Cooperative activities mean that there's more information sharing and resource sharing, whereas your coordinated and integrated activities indicate that there's been more intention put in how organizations can enhance each other's capacity and share common knowledge and programming. So during the pandemic, about 42% of the relationships were considered cooperative, and fewer of them were thinking about intentionally enhancing each other's capacity. Not to say that they weren't enhancing capacity, but there wasn't the same intentional thought process behind these activities. And only about 4% of the reported relationships indicated that they did not do anything with each other during the pandemic.
For the integrated activities, it was 21%. I see that got cut off, but it was 21%.
Sorry about that. In addition, we asked about the purpose of these relationships. And during the pandemic, most of them were related to like client referrals, data sharing, and funding, although certainly client assessments and service delivery were important pieces of what they were doing. So while you were all working hard during the pandemic, we also wanted to understand what your sense was of the network as a whole and how it was functioning. This may be unsurprising to you, but many of you did not necessarily know how well the referral process was functioning during the pandemic. In fact, 71% of you indicated that you did not know how well the discharge planning was going. Aspects of the referral process, including data sharing and how clients move through the network, were also places that seemed to be places where individual organizations didn't know a whole lot about what was happening. Referral follow-up was an aspect that many believed wasn't working particularly well as wraparound services and having a centralized point person. There were places where you did think things were working well, and those tended to be around your partnerships with other nonprofit organizations and how well you were meeting with other organizations about the referral and service delivery. Additionally, many of you felt that the centralized resource tools like Unite Us were working well. One of the other things that was reported on was how these relationships were changing during the pandemic. And 56% of the relationships were reported to have not changed since the beginning of the pandemic, with only about 5% reporting that they were weaker as a result of the pandemic. Most of you reported that funding came from donations and grants and support from foundations, but certainly COVID-specific funding like the PPP loans and funds from the CARES Act were also important. Interestingly, more organizations believe that they were financially stable during the pandemic than believe that to be the case back in 2018. And this is something, as we go forward, would love to dig into a little bit more about why that may be the case. So within the network, there was high trust, and that differed little by service type. So health systems, public health service organizations, social service organizations, and other organizations were similarly perceived as highly trusted members of the network. In many cases, this is a fact that's, this has in fact increased since 2018. Particularly reliability and open to discussion scores have increased since 2018. Value of network partners has slightly lowered since, was slightly lower than what we saw in terms of trust within the network. And this did differ some by service type, with social service organizations being perceived as having less power and influence, level of involvement, and resource contribution. And there are a couple things to keep in mind. One is this is occurring during a pandemic, and there are certainly different stresses on organizations. And as carrying capacity decreases for some, that may mean that that impacts these dimensions of value. Additionally, we don't, as we've seen, organizations don't always know what's happening within the network as a whole. And it could be that some of the contributions made to the network aren't readily seen by all members of the network, which could in turn affect these scores. All of that is important to consider as we think about what outcomes are different relationship are happening within these different relationships with organizations. So you were asked about outcomes that resulted from your partnership. 38% of those relationships were reported to have improved the capacity of the community to address unmet social needs, improved services, resource exchange, and improved organizational capacity were also frequent outcomes of these relationships. However, as improving capacity of the community to address unmet social needs was one frequent outcome, and two, from the study standpoint and from probably the community standpoint, an important one, we thought we'd focus a little bit more on those relationships. So for example, we wanted to see if there were differences by whether or not the relationship improved the capacity. So we looked at some of the organizational relationship focus areas when they resulted in improving the community's capacity compared to relationships that did not necessarily improve that capacity. Those that improved the community's capacity tended to be focused on things like advocacy and policy, data sharing, development of standards and tools and protocols. And in addition, funding was a major focus of these relationships. So relationships that improved carrying capacity of the community were more likely to be involved in, say, data sharing, funding, advocacy, and joint programming than those that did not necessarily improve the capacity of the community. So with all that said, we asked sort of, what does it all mean, right? And what have we learned from these findings that give us some insight into how the network functions during a crisis? And what do we do as we enter this sort of new phase of the pandemic? And with that, I'm going to pass back to Cameron to talk about some of these takeaways and final thoughts.
Thank you. I'm just over here writing some notes down. Okay, so some takeaways from this, and I think you all saw these in your reports. Our large diagram shows that no one type of organization is dominant, but there is definitely opportunity to better connect and pull those healthcare organizations tighter into the center there. And I don't want to forget, Amanda and Rose, to talk about location in the map and the size of the circles and what that means. I don't think we touched on that, but I've had some phone calls about this since we released the study, the difference between the trust and value scores. And if you had, first of all, Rose said, all of us in social services seem to have a little bit of a lower value score. And I'm not too upset about that, because I think really it boils down to knowledge exchange and information exchange, especially with high trust scores. So obviously we trust each other, but the value needs to be worked on. And maybe I think it's because we just don't know exactly what each other is up to. And obviously we don't know if our clients are completing their services and getting the full services that they need. So there's work to do there. And definitely we were sort of laughing the other day on a call with the team, because I said, holy cow, this network map looks like we just grabbed onto each other's arms and held on for dear life. And that's kind of how it felt, right? Like during pandemic, and we're still in it, unfortunately, which I still feel like we're holding on to arms. But I think one thing we can ask ourselves is to what end? What are we trying to do? Is it really help the community, help people be healthier? And how are we doing that more strategically with better outcomes? And how do we share that information that the individuals that we serve are getting better, are getting the services that they need? The last one, the referral relationships in particular, are received strong. So big props to First 1000 Days, Unite Us, and Barancik Foundation. I think Unite Us has moved the marble in a lot of this forward, but there's still so many of us in the community providing services who aren't on the platform. And maybe we should continue talking about that. And it highlights a community-wide need for better data about referral outcomes. Yes, I agree. Next slide, please. So how valuable has the network been during the pandemic? We activated very quickly. I don't think I had any doubt about that, even through the chaos. One of my favorite quotes is, we're all the same size on Zoom. And I felt that way during the pandemic. All the power dynamics are equalized, and that was sort of a silver lining, very much a silver lining through the whole crisis. But many organizations believe the relationships were important and a lot of trust. Great. We are not sure about outcomes and processes, and I think we could do better there. And priorities may have been dictated by immediate needs of organizations. Again, I really do believe that's just kind of, we were all in survival mode. So, again, snapshot in time during the height of the pandemic. How can we act more intentionally during the current wave that we're still in? Are there organizations that need to be better integrated into the network? And we are suggesting that that's the healthcare and clinical care systems. What outcomes are the most important to the mission of improving the capacity? How do we make them visible to everybody in the network? Even today, there are plenty of people that I know in the community that need to know this data. And we're going to share beyond just who's on the call today. And after this, we are going to share it with the 88 partners that only 67 of you completed the survey, but I do feel it's important that the 88 know where their organization positioned in it, because even if they didn't participate, you answered on them. So I think that transparency is important, and it goes beyond the 88 actually. So what have we learned from the last 19 months? I don't know, it all feels like the same day, right? Groundhog Day, but that can be used to improve the services and care provided to the community. I definitely would like to have some open dialogue about that question. And then, it's even hard to say the word next crisis or pandemic, but how do we use this data that we have if we do have another pandemic? I was on a call this week with the Dean of Pharmacology from USF, who told a community group that there could be another pandemic in 5 years. And I think the initial response was like, we're not ready, but now that we have this data, how can we better prepare for that kind of unfortunate, issue in our community? How do we leverage foundations and fundings in strategic ways? And I really like this pull out here of how do we define value in our partnerships of level of involvement and resource contribution. What's important to track for us? And are there better ways to measure or think about this network and organizational capacity? Right off the top of my head, I can come up with multiple network subgroups that are functioning in our community, like the Community Alliance and First 1000 Days, the Season of Sharing Network. And they all are in different stages of looking at their network and thinking about this efficiency issue and what's best for the community. This is awesome. This is all this data feeds into how we're functioning within those networks. Okay, I'm going to turn it back over to the VNL team to talk through your personal profile that you all have access to now.
Thank you, Cameron. So I'm Amanda Beacom. I'm part of the VNL team, and we wanted to take a moment here to talk about the reports that we've sent out that document the survey results in more detail than we're able to do here. And so we distributed to all of the survey respondents 2 types of reports. One report, which Cameron sent out to you, was a report of all of the aggregate results across all organizations that were surveyed. And so it's a summary of all of our responses. And that's what Rose presented to you today, highlights of that. And then the second report that we sent out was a report, again, to survey respondents about your own personal organization's results. And so we wanted to give back to you your individual results broken out from the aggregate summary to show you how you really stood in the network and what your own individual networks within the larger ecosystem look like. And I wanted to take a moment here to talk about how you might be able to use that data going forward and why you should bother, opening up those emails and looking at those reports. I do want to say before I get started, if you did not receive those 2 reports, please be in touch with Cameron and she'll let us know and we'll get those out to you. We sent them to the person who originally received the survey in your organization, but if that person has left, or if they're on leave, or if for some other reason it didn't get to the right person, let us know because we really want to get those results to you. So with that, let me talk a little bit about the personal results. So before I get into the meat of it, I do want to say a couple of caveats. These are caveats that Rose and Cameron have already discussed, but I really want to underline them for you when you look at your individual results report. Then the first one is that we had a great response rate to the survey. It was 76%, which we all know is really great. I mean, anything above 50% these days is excellent in terms of survey responses. Generally, the rule that I used for network surveys is that we want to try to get above 70%. So I was really happy with the response rate here. And I want to thank everyone for taking the time to send in your thoughts and feedback on the survey questions. However, 76% is not 100%. And what that means is that some of your key collaborative partners may not have responded to this survey. And so that will impact the results that you see in your personal profiles. So if some of your really key partners to your own work did not respond to the survey, that means that your personal results may be skewed to some degree. So I want you to keep that in mind when you're looking at your personalized reports. Second caveat I want you to keep in mind, and this is something that Rose and Cameron just discussed, but whoops, I want to underline it, and that is that perceptions of trust and value are subjective, and in some cases, they're also immutable. Let me explain what I mean by that. First of all, you all understand that all of our perceptions are subjective. How one organization views another is really different from how the third organization may view that same organization. These are subjective perceptions. And you're reporting on these values during a pandemic, which is already a super extraordinary situation. So I want you to keep that in mind when you look at your trust and value scores. And then what I mean by these are also sometimes immutable is that they're sometimes out of our control. For example, the power and influence score is often dictated by whether you have access to influence policy, whether you are a funder and can actually fund programs in the community, whether you have any regulatory authority. Those are things that organizations cannot control. They're just inherent to the nature of your organization. A lot of organizations that do not have control over policy or regulation or funding are going to be ranked low in terms of power and influence. And so that's an example of some of those things that are outside your control, and you shouldn't perceive that as a weakness. Obviously, it's just due to the nature of your organization. And that's true with all of these trust and value ratings. If you're a really small organization whose network is not that large, you probably have different value scores from a really large organization in the community. So again, just keep those in mind when you're interpreting these scores. We ask these questions about trust and value because we know through our own research that they're valuable to assess, but they also have some caveats that go along with them. So I wanted to just have everyone keep those in mind when you're looking at your personal results. Now on to how you can potentially use these, and we hope that they will be useful to you. So the first thing that you can do with these is demonstrate your own individual organization's multi-sector collaboration efforts to funders, to boards of directors, to other stakeholders. You can take a look at both the overall network map, which is this map at the top. This is the one that Rose previously displayed for you. You can take a look at that and tell funders and other stakeholders, hey, my organization, our organization is a part of this multi-sector collaboration, working to improve services in the community, both during the pandemic and of course, before and after the pandemic. And we're a part of this, and we're working with other organizations across sectors in order to achieve outcomes for the community. So you can use the overall network map in that way. It's color-coded by sector for that very purpose so that you can show folks that you're part of a multi-sector network. The second map in your personal results profile is the map of your own organization's connections within the network. And so the map that I'm showing here on the slide happens to be Glasser Schoenbaum's personal network. And so that personal network obviously is going to look different from your own organization. But what you can do is you can take that personal network and show again your funders, your stakeholders. This is specifically who we're connecting to in the community. And this is particularly something that I think you should show off if you have a lot of connections. That's something that funders would be really interested to see, right? Second thing that you can do with these results is you can demonstrate collective outcomes of the entire network working together, again, to funders and other stakeholders. And here's where you would want to go from your personal profile results to that aggregate report that Cameron sent out. Look at the sections around the ability to activate the network. Look at the sections that are titled network successes and challenges. That's where you see some of those outcomes that I think that everyone in the network can feel really proud about. So the data that Rose was discussing about how networks within, or relationships within the network have become stronger. And the data about how you all feel that you have been able to activate quickly and provide services to those in need. Those are results that I really encourage you to share, to provide in annual reports. Those are real successes that I think overall the network collectively can feel very proud of. So please share those results and use them to demonstrate how hard you and all of your partner organizations have been working throughout this pandemic. Third, I think you can take these results and use them as an evaluative internal tool, sort of a self-reflection tool to think about how your organization is collaborating with others in the community. So take a look at the trust and value scores. That's this last image on the slide that you should see in your personal report. Take a look at where you scored highest. That's something to celebrate, and that's something to think about internally, like why did we score the highest on this particular dimension of trust or value, and to make some sense out of that result. And then also to look at where you scored the lowest and think about, again, is this something that I can change? Is this something that our organization can address? Or potentially, do we think that we got this low score because either we just, as I mentioned, we just don't have a ton of power just by the nature of our organization, or maybe because our key partners perhaps did not respond to the survey. Either way, whether you think that the trust and value scores are actionable or not, use them if you can to do a little internal self-reflection within your organization. Be sure to celebrate any successes that they reflect, any high scores, and then think about whether they tell you anything that you can act on to improve collaborative efforts.
Amanda, I just want to ask two quick questions.
Yeah.
The color code for the graph in the middle for any organization, is it on that profile? Is it in? Is the key there? Because I don't remember seeing that yesterday. So
yeah, so the key for the overall network map is there in your personal profile. But when you're looking at your own network map of the connections that just your organization has, there is no key to that. It's just randomly colored.
Okay.
So colors of the organizations in that map don't have a particular significance.
Okay, I'm asking because if they're evaluating their network and looking at, geez, we're missing certain sectors that might be helpful to our clients served, I'm just going to think through that for a second if that would be helpful. Number two, on the bottom one, so the bars are their organization and the dots on the sliding scales is the entire network, right?
Opposite, the bars.
Opposite,
yeah.
The network, and okay. All right, so just making sure everybody's interpreting that correctly. So the entire network's on the top. Where you stand is the are the little sliding things on with the dots on the the bubbles, I guess, on the
exactly.
bottom.
Exactly. Thank you, Cameron. Yep. And then finally, and I see we have some questions or comments that are popping up in the chat, and we are going to get to those in just a moment. But the final way that I think that you can use these results, and this is something that Cameron referred to, is to think about how the entire community is functioning together, particularly around the community referral system, which is what this survey really tried to hone in on and focus on. How were referrals working during the pandemic, and how are they still working as we struggle with the Delta variant? I think that there are a lot of interesting results in the aggregate report that you can study and mull over after this webinar. in thinking about that. But for us, as total outsiders, one of the really interesting things for us was that when you responded to the survey, many of you felt that your relationships had gotten even stronger during the pandemic. You felt like referrals were going well, but you were clear in the fact that you didn't really have a ton of data to back that up. And you weren't really sure exactly precisely how those referrals were going. And as Cameron said, people felt really good about how their referral relationships were operating, but the actual outcomes of those referrals were a bit of a question mark. The network wasn't quite sure what ultimately occurred for those individuals that received the referrals. And so that's something to think about. How can the community moving forward address that sort of black hole or that question mark that you have? How can you work together to try to really be able to understand the outcomes of referrals better? Go ahead, Cameron.
I was just I was having a chat with Ashley Brown this morning about this, and sort of a kind of an existential comment about what is our responsibility as a community to know the outcomes of the people we serve. To me, it's major, right? It's why we're here. It's why we do what we do. Okay, well, if we all sort of agree around that concept, how are we tracking it? How are we measuring that? And the so what of that? Before we skip to that last slide, I really would like to have a little bit of conversation. I know we have time, and jump back to a slide where it broke down the concepts of value and trust. That, by the way, those two variables are always what we get the most comments about from partners. And I think if you look at, like Amanda said, where your lower scores are, in my view, with my own team, our own team here, I call those opportunities, right? Like how did that happen, and what can we do to better affect that change? Our group here has been talking about networking, not this kind, but like cocktail party networking, and sort of the value of that. And we've lost a lot of that during COVID. And I think that's reflected here too. And that's where a lot of the information exchange happens. I know if you're here today and you're a tenant on our campus, we miss our lunches, right? Our quarterly lunches, which are really informal networking opportunities. And we haven't been able to do that. So maybe some of that value is measured or is lost in not having this time where we are all holed up in Michael's together or whatever, and really exchanging that kind of human to human knowledge and capacity and capital. Really, it's capital. So it wasn't this one. Can we go to the one that broke down what was one of my slides? Go forward from this. Keep going. I mean, towards the end, where it was one that I reported on about the results.
I'm sorry, I'll go back. Sorry, audience, bear with us.
Yeah, one more. Right here, consensus on how we define value in our partnerships. This entire question right here is one that I think is really important as we move the study findings forward, especially through the lens of don't want to say it, but another pandemic or crisis, and our level of involvement and resource contribution. I do want to thank the foundations that were in the center of that network. They were in the center of that network for a very real reason. Actually, can we take this opportunity to explain your place in the network and the size of the nodes?
Yeah, yes. So I'll say a couple of things, Cameron, and then I want you to jump in and add some additional comments. But this is the overall map of the network that Rose was showing earlier. And this is the one that is color-coded by sector. So again, just to orient you, the green circles are social service organizations. The teal or blue circles are health systems and clinical care organizations. The purple circles are public health service organizations, and then orange is all other types of organizations. So that does include foundations. And one thing that I always like to underline when you're looking at this network map is that the nodes or the circles are sized according to how many connections or relationships you have with others in the network. And so what you'll see is that the larger nodes with more connections tend to be at the core, the central of the network. And then the organizations with fewer connections tend to be on the periphery. This is a very, very typical structure that we see in community coalitions and community-wide networks. And there is value and importance in organizations that have or hold both positions. So the organizations at the center that are larger and have more connections, of course, are valuable. They're more connected. They can reach more people, disseminate information often more effectively just because they have more connections. And they're often positioned well to be and act as network leaders. However, organizations at the periphery that have fewer connections are also extremely important because they tend to be the organizations that act as bridges to other types of organizations or residents in the community. So those organizations that don't have that many connections in this network may have a ton of connections to other types of stakeholders in the community that may be important for this network to connect to. And those organizations that are on the outer rim or on the periphery in this network may serve as very important bridges to folks that in the middle of the network are not connected to. And so that's why both positions are important. And I don't want anyone to assign a value to those positions. They're really equally important. And generally, we call this in network science a core periphery network, meaning just that there is a core of organizations that are more well connected, and then there are many organizations on the periphery. And we generally view this as a very sort of healthy, well-functioning structure for a network. So Cameron, now explain what that all means and
yeah, so a real life
science.
Right, a real life example. So on the left there, on the far left, a blue dot, JHC. Guess who that is? You'll be surprised. It's Johns Hopkins All Children's, okay? And when I say that, right, we all know how valuable they are in our community, especially in COVID right now, and the work that they do here in the location they have on Clark Road, and the primary and extreme, what am I trying to say? Specialty care that they provide for children in our community. Now, they're on the outside. Why? In my opinion, it's because they have a very niche focus in our community, right? They serve children. They're not serving everybody, and typically they serve pretty ill children. And so while they're there and they're a part of our network, and just to kind of go deeper on this graph, those kind of, you can see there's arrows pointing into the dots there. I know it's a little messy and furry, but you can see the arrows going into that Johns Hopkins All Children's dot there where the arrow is. And that means that they're getting referrals from us. They may be not referring back out to many partners. Hopefully, by the time the children are leaving their facility, they're well and not needing all of us in the community. But again, that is an example of one of our findings, which is maybe we need to do a better job in our community of bringing healthcare systems more into the middle, right? Maybe we don't know what their needs are or their family's needs are. Maybe we need better connections with their case managers. So that's a healthcare example right there that we know the value and we know we have trust in that partner, but they're on the outside of that circle because they're serving a very specific community for a very specific reason. I hope that makes sense.
Thanks, Cameron. I'm going to stop sharing for now. And we would love to open it up for questions. Obviously, we're at the top of the hour and some of you may need to leave. You should feel free to do that. But if you have questions or you want to hear what questions others may have, please stick around. We really want to address any of your thoughts or feedback about this and have a great conversation. So I'm just going to go to the chat right now and take a look at some of the questions that have been posted there.
Just real quickly, want to give a shout out to our board members who are on the call today. Thank you so much for coming, and to representatives from Robert Wood Johnson Foundation. Without you, we could not do this work. So thank you, thank you, thank you. Before we deep dive into questions.
Thanks, Cameron. Someone asked that our network map is cut off around the edges. Is there any way to get a full view? Absolutely. You can actually, when you look at your individual profile online, you can use your mouse to scroll in and out and adjust your view of your own personal network map. However, I sometimes find it hard to do that. Sometimes I have trouble figuring out how to do that. If that's the case for you, please email us, email Cameron, she'll let us know, and we'll send you a view that is not cut off. So please be in touch if you're having trouble with that. Let's see. Okay, there's all questions in the chat about that one point. So great, thank you. Other questions or reactions to the survey results? And you can just come off mute if you would like.
Nobody else is responding?
Go, Lou, it's your turn.
You know me. I got it. And my mama said, if you're going to be there, let them know you was there. I got here kind of late. Me and Cameron was talking about some issues, and I went on a state national call-in just a few minutes ago. And Cameron, that conversation we had was the first thing on the agenda, how you get funds into small grassroots organizations and have big organizations be the fiduciaries. They was talking about it, and apparently they got a model in North Carolina that's doing just that. I served on United Way Board in Detroit, Metropolitan United Way Board for 8 years, longer than anybody. And one of the things I told about, and I also sat on the grassroots organizations that was in the neighborhoods. And one of the things I found is that the groups that's in the neighborhood, they're open 24/7. They're small group organizations. Sometimes they work right out of their house, but they're open 24/7. So when a crisis happens in that community, personal or neighborhood-wise, they knock on that door, and the big organizations close at 5. So I said, you got to help. And they don't have any funding. A lot of times they don't have cars, or they drive around with what we call hoopties, just trying to get around. And then we have these big funders that come in there. And what I'm saying is that the United Way had CPAs and a finance department. So I said, we got to find a way to help those folks, because they serve a vital importance in this community. In fact, they're probably more hands-on than anybody. And so we set up a system whereby the United Way could go and get the bigger funders, but then they could spread it out to the smaller, medium-sized agencies, and then they would spread it out to the smaller ones, so they wouldn't just be passing the hat every time a crisis come up. And it worked out good, and they got feedback, because we was putting programs together that didn't have a clue when it hit the streets, when it hit the neighborhood. And so what I would do is go to the focus groups. They had these focus groups. One was run by a woman that was on welfare and had a 501c3 neighborhood group. So when I wanted to see if the program would work or what they thought about it or how they looked at it, I would go to that focus group.
So Lou, I think you make a good point about how do we activate grassroots networks, and how does it all kind of have a trickle down and a positive effect in equality and equity of access to networks, right? That move community initiatives forward. We have a lot of work to do on that in our community. And, you know, one of the surprising findings that Rose mentioned during her slide was the healthcare disparities that apparently, like, we all knew about during COVID, we know about, and slid off of the radar for this network. And that bothers me, you know, and what does that mean? And why wasn't that more of a priority for this network? And where are we on that? And how do we do that better? But I agree with you. United Way is a network model, right? So you've got, you know, a funder that brings in dollars and then gives it out to the community. Most community, you know, all community foundations are structured that way as well. And they are very active networks. And part of our issue too is data sharing in our community and how transparent we are with the data that we have. And we need to do a better job, and on all levels, at every level, sharing the data that we all sit on or not. I've always said that that's partly due to not having a major research institution in town, like a major one. Yes, we have USF and New College, Ringling, they're all amazing. And we all have partnerships. Most of us have partnerships with their students and their data science students, and they do fabulous work. But when Scope left the community and when Scope left, there's really no like collective data hub here. And I think we all struggle with that. And when we need it, we're frantically asking and running around like, who's got this and where does it live? And we all know that Florida Charts is like 12 to 18 months behind in some categories. And it's a data desert here in some ways. And I think we could do better in data sharing.
I just got a call from one of my board members who's in Washington right now. And he said all of that money that's coming out, they said they're stopping everything unless you got some data to prove the point. He said, we're not, that's what he said, everything gonna be data driven that's coming out of Washington now on all of these big projects. So you're right, well, data, without data, you don't really understand the problem.
Or where to go, you know, or where to go, where to invest, where to spend our limited resource budgets that Danielle mentioned, you know, where do we come together? So we have to.
Why are you saying this? Why are you saying this? And right. In other words, what I found when I was with United Way is that we was fighting symptoms, but when you got the data, you know what the problems is. A lot of times, you know, like they got drug problem. Now, the drug is not the problem. The reason why they got to take the drug is the problem.
Right. So
and with the data, you find that out.
Lou, I adore you dearly, but I'm going to see if anybody else has some comments too, or wants to chime in and ask any questions. I am getting some emails, Amanda and the NL team, that people can't find their reports or their links. So I will forward the reports and then get you the links to your profile. And it is so nice to see so many of you here on this call today. And please do reach out to us. Like I said, by the way, we have another year of funding with this. Yeah. Do you want to talk about that, Amanda, or is it okay?
Well, I just wanted to make sure that that came up and that we mentioned it to all of you that so we have 2 years of funding on this research project. And so we are coming to the end of our first year, but we have a full second year of work to do. And so there are a couple of things that we have thought about doing and proposed doing in that second year, but we'd also love to get input from all of you about what you'd like to see happen. So some of the things that we have thought about doing are taking a deep dive in some of the survey results that we were surprised by, or we didn't quite understand, or we want to know a little bit more about, and doing some more in-depth interviews with some of you and with other stakeholders in the community to really understand those results better. So that's one thing that we're planning on doing. We're also going to do some more sophisticated analyses of the data and publish some reports and papers on that. And we'll certainly keep you posted on those results. And then finally, You know, when we wrote this grant proposal and obtained this money from Robert Johnson Foundation to do this work, we did not expect the pandemic to still be going on. We did not expect that all of the organizations in your community would still be so stretched, would still be dealing with this in the way that you are right now. And so we want to think really carefully about what else we should do in light of that we didn't initially propose. I think that this pandemic just continues to surprise all of us and confound our expectations and our plans. And so what we were expecting is at this point, we would be reporting to you and we would be talking about the pandemic as if it was, you know, in the past and something to look back on. And that's really not the case. And so we're wondering if there's some additional data collection that we should be doing or some additional questions we should be asking just that reflect the duration of the pandemic. So that gives you a little bit of a flavor of what we're thinking about doing. We, as I said, would love to get feedback from you about what you would like us to work on. And Cameron, if there's anything that I've forgotten or that you want to add, please do so.
I see Chuck Henry here and Melissa and some of our healthcare partners in the community. And I'm really curious from you all and Chelsea and your SMH team, what could the nonprofit human services community have done bigger or better to help you all in all the things that you had to do to respond in a pandemic and we're all in this together, right? So could the nonprofit human services community provided more access, more data, more support to you and on all the things that you were trying to triage and still are, unfortunately, like Amanda said. I think the gut check of, oh my gosh, we're still in this and we didn't expect to be was really something. And we do want to talk to Robert Wood about it too, as we put the lens on what does year 2 look like for this. I mean, traditionally this would be like paper writing year and those kinds of things, submitting to journals, but I still feel like there's such a story to be told here within our network that there's more to discover. So Chuck and Chelsea, and I don't know if Pam is here, but and anybody, and Melissa, you know, those of you that are providing really intensive traditional healthcare services, how could this network have better helped you? How can we still better help you during this time? I would love your feedback on that.
Well, I don't know about anybody else, but we're still kind of flying by the seat of our pants. So
yes, right. We feel the same way. Yeah, professionally and personally, right?
Yes, I think at the beginning, especially the changes that occurred constantly, the policy changes. But I don't think I'm not sure what you all could have done to help, but something in that first probably 6 months, because the policy changes, I think everyone will agree, it was daily, sometimes yes. Twice a day, things would change. So knowing what was the same and maybe all of us working together so we were getting the same policies at the same time. That's about all I can think of.
Chuck, anything you want to add in there?
Well, I think Melissa hit it right on the nail, right on the head, so to speak. As I was thinking about your question, the biggest help that the network of human service organizations always does for us is get information out to everybody they're working with and helps get a consistent message out to the community so that we can move as one and are much more effective. That was very, very challenging through this, continues to be. As you see in the news, we have a new Surgeon General now in Florida and new policies. And so as things evolve and change with policy, and policies are different with some organizations than others, and it's made it very, very challenging with this particular pandemic to come together as a community and get one message out and be consistent about it and work collaboratively. Although there's some really bright spots that I could call out through the middle of this that continue to do good things in our community, and not the least of which is another acknowledgement of the health disparities that exist in our community that we know about, that we've struggled to think about how to deal with over the years. And this really shines a bright light on the need to get on with that work. And at least my organization is going to have a big focus moving forward in the next few years on some of that work. Wonderful. And we'll be looking for lots of help from all of you.
We're here. I think that's kind of, when I saw the network graph the first time, yes, it's a huge spider web and sort of messy, but I kind of had a warm fuzzy feeling because wow, like we're here doing this work. And yes, Melissa, to your point, like what day is it and what time is it and what policy are we listening to now? But at least we know that we're here, right? And we're kind of a phone call or an email away. I'm really excited about drilling down on some of the particular subcategories of this network. And if we have any interesting revelations about your category or what you're doing, we will pull you in, of course, and look to see, get your feedback. We are going to do some interviews, some key informant interviews, and those will probably be based off of some unusual or unexpected findings, which we still have to get down to. But it was really important to us to get this first overview of this network out to all of our community partners here. And like I said, I will be sending it to the other 20-ish probably this afternoon that were invited but didn't participate because their organizations are on there. And feel free to share it if there are other people in your network that you think the report would be valuable. I know it's meaty and hefty. I'm always, myself and our team here and Amanda, Danielle, we're always willing to talk about it with anybody to better understand it. I do believe that the data that you have in your profile can be used to for your board members, your stakeholders, for grant writing. I think it's quite valuable to show. I was in a meeting this morning and heard somebody say, it helps break down the silos. And I just want to scream, like, we don't work in silos. We are not in silos. We can't, we don't have time to work in silos. It's just not, it's not effective for the work that we do. I couldn't have said that about this community 10 or 12 years ago, but I am 100% convinced that we are not operating in silos right now, as evidenced by this data set in even in 2018. So proud of everybody who's a part of this journey with us.
But Cameron, I will say that COVID has impacted our ability to have time to connect and do the things that, that we need to do because we're so busy focused on that issue.
I understand. That's what I was saying, like the networking in a cocktail party situation, not just networking in a spiders and spokes and pokes and webs and stuff, the graph, but yes, we haven't been able to physically see each other. I think of AFP meetings where there was so much just chatter at the beginning and we all caught up with each other. Those haven't been happening. So it is hard, but at the end of the day, I think we all need to feel confident that we're still here. Even though we're not seeing each other, we're still here and we're still open for collaboration and cooperation and capacity building as a community.
Cameron, on that note, I just wanted to interject and highlight a couple of comments we have received in the chat. One was around potentially the fact that some office hours to talk about network and collaborative strategy might be really useful. So that was one suggestion. And then another suggestion was around thinking about whether we could take or slice the network map in different ways. So if we categorized the organizations in the network map, not in terms of social service and public health and clinical care and other, but in terms of different categories, we might gain some additional insights. And specifically, there was a suggestion to potentially break out mental health from social services and how that might give us a different view. So wanted to bring those up.
Happy to do that. You all let me know what slices you would like and we can pull that out and have a conversation around it. I also, not to create more meetings for everybody to come to, but I am aware of where this information can be shared, like the Behavioral Health Stakeholders Consortium. So if there's already natural groups that are formed of interest, similar interest, we're happy to share the data through those existing networks. Does that make sense? Erin, I'm thinking about you with aging. Maybe we could do that in your aging stakeholders group too.
That would be great. Thanks.
Yeah, and Sean and all of our early childhood folks on here, right? Yes. Foundations, we can isolate your data too.
And I want to make sure we are a senior friendship center. So we're feeding a lot of people. And when the pandemic first started and, you know, the feeding agencies gathered around the table, somehow we got left out of those first few meetings. We were feeding about 60,000 meals a month at the peak of all this. So that's not small. And I want to make sure that, you know, if there are other spin-off groups, we can join the table and discussion on that, because we want to be there so we can be a contributing partner.
Sandra, you were here. I don't know if anybody from All Faiths is still here, but happy to look at sort of the food aspect of this. That definitely is always high in the ranks of social determinants of health work, for sure. Yes, Renee.
Hi, I'm a board member. I don't know if there are any left on the screen, but
yep, I'm here.
Oh, good. I want to commend Erin. I've known Erin for years, and she does an amazing job at the Senior Friendship Center. She runs it like a queen would. I can vouch for that. So we need to be on your side, Erin.
Erin's got lots of love and support.
I'm on everybody's side. I'm happy to be on everybody's team. You just don't want me on the front of the line on volleyball.
Good for you. That's all.
All right. Without any further questions or comments, I think we are concluded here.
Thank you so much, everyone.
Thank you to VNL for putting up with our team here, and to everybody on today's call. More to come soon. Thank you.
Thank you. Bye.
Bye.
All right, bye-bye.
Bye.